How's that body responding? That'll do everything to maintain a higher oxygen to the point of a heart attack. It'll increase the blood pressure. We were having dinner one night in Tacoma, and one of the docs got a call from a patient that had actually been to one of his little table clinics, and he talked about the fact that heart rate could be a very big thing that the appliances could help with. Now, she didn't do anything about it, but she was in a small town hospital with her nurse friend, and her pulse had been 130 all day, and try as they may, they couldn't get it down, and wanted to move her to another hospital for a pacemaker. And the nurse said, I'm a little alternative, and I think you said to this doctor that it could be done without a pacemaker sometimes, and is there anything we can do? Because they're afraid she's going to have a heart attack at 130 beats a minute instead of 70. That's almost double. And he said, yeah, you got some Kleenex. And she tore her Kleenex in half and rolled it up and made a spitball on each side, pushed the jaw forward in the forward position, and called him back in 45 minutes. They were checking out of the hospital. Now, with that kind of knowledge, how many lives could be touched, just like my wife's before surgery, if you knew how to fix the problem so that the physicians were happy with it and more than happy to take them off the medication. They don't know what to do. They need you. They need you to tell the world that there is a better solution than just 30 prescriptions, half of which are to counteract the side effects from the first 15. And listen, when I had a kidney stone attack, I don't like surgery. I don't like drugs. I was screaming for Dilaudid, and they could cut me open right there in the emergency room, waiting room. There's a place for it. But I'll tell you, if you can calm that person down with an appliance and get rid of the pain, and we were thinking of this, sleep, snore, and so much more with one of these appliances. It's the smartphone of dentistry. We make this already, and we got some really primitive ones out there that look like they came from the Spanish Inquisition. But there are some smart ones out there now with the contours and functional balancing that brings the body into harmony, and it is more than miraculous. We are so unaware of how fearfully and wonderfully we're made, and this is it. The first thing a CPR is check the airway. That's the last thing we ever do. Is how's the dentistry checking affecting the airway in a functional way? So this allows us then to make an appliance that has the contours. Now this is me. I had a root canal tooth removed, and I just didn't have a bridge. I had appliance put in. So this appliance now, when the tongue comes in, fills in that void like a bridge. I mean, I could have a bridge, but you better make that bridge so that it guides the tongue where it needs to go, or I'll be a basket case. I mean, literally, Dr. Robinson saved my life. I had a lot of serious things going on with my heart, which were corrected, and a lot of emotional, spiritual problems as a result of living in adrenaline all the time. And it affected my marriage, it affected my relationships with my staff, and all that got better. I'm still crazy. But it isn't because I'm full of adrenaline, and it isn't because I can't breathe. And I sleep better. I'm 74. I'm drug-free. and I'm enjoying life. Actually, I just started a whole nother practice. And it's only because things are in balance enough so that I'm functioning better than propped up by a bunch of things treating symptoms. So we've got this, Joan made this beautiful analogy. The tongue is really supposed to sit. This is a first full 4 bicuspid extraction. This is the mandibular cast. The first bis have been removed, and everything has been wrapped around that. See how good that did? It scrambled back up anyway. But the patient had the orthodontics done. My granddaughter just had it done. 3 dentists, one of them were on the dental board in California, all agreed there's no room. She will have to have an appliance. My smartphone just told me that there's some message here from the lady who's trying to sell my house, and this phone couldn't do that. She couldn't even get me right now. This is how the tongue lays. Now, you've heard a lot of things about where the tongue is supposed to be, and I think most of it involves having the tongue forward and on the backs of your upper front teeth. Well, if it is, it's also touching the edge of your lower teeth. It's laid out there. It's not diving down under behind. That wouldn't be behind the front teeth anyway. But to get patients in here, you have to have some space. And when they took out that tooth and that tooth, there was not enough room, so the tongue gets trapped. It comes in and it's got all these what we call scallops. We're going to show you a picture. When you see those scallops, you got yourself somebody that needs to know that. I mean, they don't know they're choking. It's like the frog in the water. They just, life keeps turning up the heat. But those scallops are your diagnostic tool. And you start looking at patients in their head position and their body position, you realize what the tongue isn't doing or is doing. And those tori, it's just God built a system to try to compensate and give some skids for that tongue to get up there. That's pretty good. But you can actually facilitate the tongue getting up with an appliance. Like this, I have those tori, but not as bad. And I don't have first bicuspids. I have a 6-year molar missing. But the deal is, when this bicuspid was taken out, a whole passel of other problems could occur. Not that they always do, but statistically we know that those first bicuspid extraction patients, especially ladies, have some TMJ problems. And all they're doing is clenching and grinding, trying to open up that throat. Now, I had another kind of problem, though, that I will share with you. Look at how flat those teeth are. And I went back to the dental school after I graduated and told my professor, Crown and Bridge, that I was doing this grinding and pushing my jaw forward. And he said, "Oh, you're just a type A dentist." And so he ground on my back teeth, and I walked out of there pushing my jaw forward like I told him I was. He thought it would quit it. So I went to Georgetown when it was a dental school, and they said the same thing. We just need to grind on your back teeth. Well, they ground on my back teeth, and I still kept pushing my jaw forward. And I went to a lot of gurus all over the country, and a lot of money was spent trying to get TMJ appliances in, and I appreciated all their efforts, but I'd eat them up like a piranha. So I finally, after my daughter's death and almost losing another one, and praying, "Lord, just show me what's going on," I got some help for myself from Dr. Robinson, and he said, "Well, praise the Lord that you ground your teeth off." He said, "You've been trying to get your jaw out there so you get your tongue out of the back of the throat. You know, if your tongue is attached in the front and you move it forward and you can get those front teeth out of the way, you'll live." And I did. I was struggling, but I still was living. He made the boat ramp to get up out of there, and in 2 days it changed my whole life. What I'd been trying to do was to at least get the jaw forward. So you build a nice case of Crown and Bridge, all cosmetic and beautiful, and if you've got them locked in there, they're going to destroy it, or try to, or they're going to die, or they wish they were dead because of the problems. Now, we're talking some serious stuff here, because we can make or break many times the overall health issues if we know these facts. And so basically, this phone keeps talking to me all the time. So we pay a price for some of the technology. I have to wear this thing. I have to listen to that or cut it off. But the deal is, it's the difference between me coming in here today and seeing one patient after another that this works on. This is just as predictable as the sun coming up. I'm sorry that I don't have dozens of peer-reviewed articles to give you. That's your job. But mine is, I feel like Paul Revere. I'm running through life trying to get people's attention before the good Lord takes me home. I don't want to not do the right thing. And it's like the watchman on the wall. You know, it says if he doesn't shout the alarm, everybody's blood's on his hands. And so, you know, what you do with it's up to you. But don't wait for the peer-reviewed article.